to the Voice of the Coast. I am your host, Danica Long. With me, we have Dr. Eric Melancon, St. Mary Parish Coroner. If you remember, I think our last conversation was about COVID. We've been having COVID conversations for a very long time, and I won't change the pattern, so let's open up 2024. COVID, are there COVID cases as much as they were, years prior?
Well, I wouldn't say that it's as much. We still have a few COVID cases here and there, and it comes in spurts, similar as to what we see with the flu. We actually still have occasionally a COVID death. And again, mostly the COVID deaths are attributed to people who have advanced other stage diseases, whether it be heart disease, lung disease, cancers, and stuff like that. The aged and the infirm seem to be more susceptible to dying from that disease, just as they would be with the flu.
Now, speaking of the flu, we had a really bad flu season.
We did.
Were there any very, very bad cases where it may have contributed to death?
We haven't had any reported as such, so even though there probably was, unfortunately for us, as a data gathering organization, the reports of flu causing these symptoms typically is not done very well. COVID, of course, because of its publicity and everything else, typically is. So I do think we still have had some flu-related deaths, just as we've had for years and years. And I've been a coroner for 5.5 years now, and we probably have had flu deaths even before COVID started.
Yeah, and it's so hard to kind of tell the difference between the two because they kind of have similar.
They're very similar. Very similar.
Okay. I had the flu for the very first time in my life, and I thought I was out of here. It was very bad. Yes, it was. But I'm going to talk about something a little bit different than we don't always talk about, and I want to switch gears here already. And let's talk about the Parish Council. You kind of took a little bit of a side there. A couple of weeks ago, and now we're, just so I can date myself, we're in April. So back, I believe, in March, you visited the Parish Council and you spoke. And you were there to talk about a profit and loss statement, something that you said you've been trying to get your hands on. Now that we are in April, have you gotten your hands on that? And, where do you foresee your department moving?
Well, actually, I went back in January.
Oh, it's that long ago.
So
okay.
it's been almost 3 months.
Okay.
And part of the issue is, I know we've had some budgetary issues with the parish, even though I personally got an email from the Parish Council saying that we had a $20 million surplus coming into this year. But as soon as our new parish president, Mr. Jones, takes over, he comes to find out that we're $2.5 million in debt, which I'm not sure where the $22.5 million went. But again, I was trying to be part of the solution by getting a profit and loss statement. I asked for one back in 2019, right after I first took over. That's never happened. I got chastised by Mr. Matthews because, quote, I didn't know what was going on with my office, which is completely untrue. I don't know how they attribute monies to what, which is why the profit and loss statement is important. I can't help to manage those expenses and costs, even though we do everything we can to cut costs and lower overhead and things like that, because we don't really have a revenue generating source. People dying does not make us money. It costs the parish money, and the costs of all kind of things have gone up. Autopsies went from about $1,200 a pop to almost $4,000 a pop now, and that's in a matter of 5 years. Body bags used to be about $18. They're almost $60 now. It seems like everything's almost tripled. The demands of the coroner's office has certainly gone up because of statistics that we have to keep, the information we provide to the state, and I think we've done pretty well. They talk about the fact that I've increased the employee budget, but our employee budget actually is less than what it was with our previous coroner, because they weren't even paying the investigators an appropriate wage. They were actually paying below minimum wage. And to pay a coroner's investigator, the average is about $15 to $16 an hour starting. We had investigators who had been with us for 10 years. So that's a discrepancy of about $100,000 per year. And that's with no benefits. Of course, having full-time employees, I feel like benefits are important because it's a tough world out there without benefits. And these guys have to deal with some pretty bad stuff day in and day out.
Yeah, some of the things that you've actually, some of your expenses, you've had 2 vehicles. Tell me about, because one is actually, is it still in commission or have you had to take it out of commission?
Well, it's most of the time out of commission because it breaks down fairly regularly. We do have a new vehicle, but again, we have 2 investigators and they're working all the time. So the one that's non-functional gets set to the side and hopefully works when it needs to, but it was just out for over a week because it had a bad battery and electrical system.
Awesome. Okay, well, we're just getting started, so there's much more we want to cover. So come on back right here on the Voice of the Coast. Welcome back. We are here with St. Mary Parish Coroner, Dr. Eric Melancon. Let's get right back into it again. Your visit to the parish courthouse for the parish council meeting kind of stirred up some tension in there, and it was because you wanted to get your profit and loss statement so that you can kind of maneuver and know how to operate your department. But one of the things that was of question too was the pay. You have 2 investigators, one male, one female. And you mentioned to me before that they're both qualified. Actually, I think both of whom come from the sheriff's department. So they come with some skills and some experience. However, the pay is not the same. It's unequal pay.
It is unequal, and apparently Mr. Berg, when he was the CAO of the parish, chose to go back to an original ordinance that I wrote back in 2019 and go back to that pay. The problem was we had 2 cost of living increases since then, which he told me was not part of the permanent wage. Now, I'm not an economist or anything like that. It's always been part of the permanent wage as far as I'm concerned. I've fought tooth and nail to get that equalized. I think it doesn't pass the sniff test the way it's been, and I've met with some obstruction from even some parish council members. I had one flat out tell me he didn't think my investigator should be paid the same just because she was female. When I tried to explain that it was because she did the same job, she was equally credentialed, actually had another certification that the other one didn't have, and he thought it was, well, it's because the other guy had been there longer, which in all actuality had been there for about 16 months longer. And actually when he started off at the same wage as the other female employee who retired. Again, it's not passing the sniff test. I've asked repeatedly, rather than pushing through and trying to be a bullhead about it, I'm going to rewrite the whole ordinance, which I think is kind of crazy that we have to go through all these steps. But the way the parish council has functioned lately, I'm willing to do it.
Yeah, so that's going to take some time to get all this written down and I guess put it in, and it has to go through a process as well to become an ordinance.
It also costs more money because we have a coroner's office attorney who he's actually written a preliminary resolution, and that's actually in play. I do have to tweak it because back in September of 2022, I'd gone to the parish council and was talking about budgetary issues and how Judge DeMahe had pointed out that St. Mary Parish on their coroner's operational fund, which is a fund set up to help offset costs of the coroner's office, and it was funded by a little stipend tacked on to things like speeding tickets and stuff like that. And St. Mary Parish was only charging $5 a ticket, whereas Iberia and St. Martin Parish were charging $10. She asked me if it would be okay if they went to the 10, and I'm like, well, sure, anything to help improve our inflow of money to help offset some of these costs. After her research, she found out St. Mary Parish had never, ever gotten an ordinance from the state, a resolution, to allow us to even charge the 5. I asked the parish council and Mr. Hannegriff and them at that point in September of 2022 to go ahead and get that done. It, as of January, was not done. Through that meeting, Senator Alain reached out to me and said, I can't believe that hadn't happened. And I said, well, let's make it happen. He said, do you know where the ordinance is? I said, I have it written. All it needs to be is put in place. I don't have the ability to do that. So, of course, he did. He actually got it sent to Representative St. Blanc, and because it had to go through the House side first. All that politics stuff
Yeah.
is something different. And Representative St. Blanc got it passed 95-0. It's on the Senate desk waiting to be passed through the Senate, which I'm sure we may have this similar results.
And some of the names you've mentioned are no longer even in office at this
Well,
point.
no. Representative St.
No,
Blanc.
Blanc, yeah, he is. Yeah, definitely. Yeah, but I'm just saying how long the process has taken
Oh, it
to
has.
where we
It
are
has.
today.
But
right now.
it's Senator Robert Alland this time.
That's right,
You know, his
yeah.
dad was the senator before, but Robert's the one who reached out to me, and after seeing it and said, "Let's get it done."
Okay.
So.
All right. Well, 2 down, 2 more to go. I'm trying to get some more questions in here. Y'all come on back. We've got much more to cover right here on the Voice of the Coast. Welcome back to the Voice of the Coast. Let's get right back into it. St. Mary Parish Coroner, Dr. Eric Melancon. So I don't think you were at this meeting or this event. It was for New Generation. It was sponsored by Rotary. And Franklin Senior High School was one of, I guess how many schools we have in this parish? I don't know, 8, 9,
7 or 8,
seven,
yeah, high
yes.
schools.
Including it was parish, it was public as well as the parochial schools, private schools. And one of their missions or what they'd like to see is a sexual assault awareness group. And I thought first thing was, have they talked to the coroner? And that would be great for them to get involved because that's kind of your purview. Are you familiar with it?
I'm not. The program with sexual assault, unfortunately in the coroner's office, sexual assault's one of those things that's kind of, law enforcement typically handles it. They don't typically involve us. They really just want a SANE nurse. But, for me, it's not about the sexual assaults themselves. It's about the prevention. And I'm not sure what their agenda is and what they plan on doing, but I'm certainly willing to help participate and see if there's a solution we can come to, because any way we can protect our kids and people in St. Mary Parish is something I'm interested in.
Yeah. There's also a Heart of Hope.
Heart of Hope.
That's right, Heart of Hope. That's also here. Does your department also work with
We
them?
do work with them. They are the advocacy group for sexual assault victims here in St. Mary Parish. When we have a sexual assault, we send out a SANE nurse for an exam, and then that's all coordinated with Heart of Hope, and Heart of Hope is supposed to provide the supportive care and after interviews and counseling and things like that for victims of sexual assault. I've had people ask me, is it just women? No, it's anybody. Guys, girls, it doesn't matter, because anybody can be a victim of sexual assault.
Right. And that does happen. I mean,
It
and I
certainly
think,
does.
and I actually had a representative from Heart of Hope that was here, and it happens more often than we know. And it happens to small children. It happens to the elderly, and also for individuals who have some type of disability. So, I think it's very important that there is this awareness group, and I'm proud of St. Franklin Senior High School for starting something like that. And I think we need more awareness like that to happen, and for kids and people, rather, to know that they have a safe space to go to.
Correct. And the more they know about the process and the cues that might be, oh, they're just being really nice, well, that's fine. Love them, the whole 9 yards, but certainly make sure that, if something steps beyond what you think is too far, and some children and adults may not know what too far is.
Yes, sir.
So having a forum to talk about it certainly would be beneficial to everybody.
Yeah, you see, especially with social media, a lot of these new terms are coming up, grooming, and how individuals are groomed from a child, and when you know the signs, then you know what to look for. Also, unfortunately, your business, you deal with a lot of suicides. We talk about that as well. We're in the month of April. How are we looking as far as our suicide rate?
Horrible. We've had 4 suicide deaths already this year, I should say. Unfortunately, all 4 of them men, probably between age 35 to 45. 3 of them were gunshots, self-inflicted. One guy actually jumped off a bridge. Statistics will tell you guys who attempt suicide are more successful than girls. I would hope nobody would ever attempt. And our mental health services here in St. Mary Parish have improved.
Okay.
Could we get better mental health services overall? Yes. I mean, the access that in primary care, most of it is left to primary care. I know the Odyssey House and things like that are struggling because they have such a high burden of drug abuse patients rather than people with true mental health. Yeah. Although a lot of times, you know, the suicide stuff can be related to drugs, and I don't know exactly which ones were.
And that's what I was going to ask you.
Yeah.
You know, we have some ODs sometimes that occur, and sometimes that's, I guess, would you consider that by accident?
Well, we call it accidental. The only time we would call it a suicide is if there's actually a note, because you can't tell the intent of somebody after they're gone.
Gotcha. All right, thank you, Doc. Well, come on back. We've got one more segment to go right here in the Voice of the Coast. Welcome back to the Voice of the Coast. Again, last segment with Dr. Eric Melancon, our St. Mary Parish Coroner. What would you say is the goal of the coroner's office right now?
Well, you know, when I first took over as coroner, my big goal was to consolidate things and provide a base of information that's usable to not only the parish, but to the state and everywhere else. My second goal was to help educate our parish, educate them how. You know, part of living in St. Mary Parish, you want to live as well as we can and as healthy as we can. Unfortunately, trying to deal with, you know, the COVID issue and then deal with, you know, the budgetary issues, it takes up most of your time. So I haven't been able to branch out and help educate about suicides and overdoses and things like that. I made mention at the parish council meeting a while back that I wish I had the money to bring a fellow by the name of the Tall Cop. And if ever you have a chance to look him up on Facebook, or if you have a chance to see him, it's not expensive. It's like $30 or $35 for one of his sessions. It's worth it. And you'll see what goes on and what these kids are able to get, even at vape shops. And some of them may be local, some of them in Louisiana. I remember when I watched his lecture and sat there in Lafayette, he literally had gone into a vape shop that morning and pulled out some stuff that potentially could kill you. Wow. And it's scary.
We hear me, obviously there are lots of coroners across the state. I guess each parish has their own coroner. Have you been able to meet any of our, you know, coroners in the neighboring communities and may have come up with any ideas of maybe collaborations or things that you could bring here?
Well, we have met on several occasions. The problem with St. Mary Parish is we're in Region 3, which we're kind of ostracized from that region because we fall more into the Region 4. So the services provided typically come from the Lafayette way, whereas the services east of us all come from the New Orleans way. It's kind of, I guess, like the dioceses and parishes. It makes it very difficult. Terrebonne Parish has a new coroner, which I know him, but I haven't truly met him and sat down with him. Lafourche Parish has a new coroner, and it's not even a doctor at this point, and I haven't met her yet. Dr. Degater from St. Martin Parish and I met with him. Dr. Ditch is just retired, and the new coroner in Iberia Parish I haven't met yet.
Is that the same Degater from?
No, it's not the same Degater.
Okay. I was wondering. Degater. Okay, all right. Let's kind of go back to the parish in a way. We have a new parish president. Have you had an opportunity to meet with him?
I have, and Mr. Jones, certainly in discussion with him, he certainly has a distinct envie to push this parish forward. I think he knows that the parish has a lot of potential. Unfortunately, in the last 8 to 10 years, we've had nothing to grow this parish. It's been a fairly stagnant parish, and again, it's our fault. It's government fault. It's financial fault. It's COVID fault. You can blame all you want, but somebody's got to take the initiative. And at this point, I see him with a lot of good plans. Unfortunately, the parish council has not been very receptive, which again, I'm not sure why. I may have offended a few when I said that if they weren't willing to move the parish forward, that they should write a resignation letter, because I will continue every day to work to make this parish as good as I can do, but you know, it takes a village. It's not one person, and I know you do all you can to help educate the people of St. Mary Parish and be a spokesperson and voice for those in need, and we need more people like it. And I think he's got a great potential. He's been at all levels of the state government and parish government and things like that. So I think we all should get behind him and support him.
With that said, I'll let that go out. So I appreciate you so much for being here.
Thank you.
We'll see you guys next time. Take care.